Welcome to another edition of the DHHS Heart of Excellence Award recognition. I'm pleased to share the names and brief stories of the recipients for the Spring 2024 awards. The following recipients have demonstrated our department values of connection, impact, empathy, innovation, equity, accountability, support, and efficacy. And now, let's get to the awards. The award for connection goes to BreAnne Osborn, an epidemiologist with the Division of Population Health. During a 2023 outbreak of E. coli illnesses, at least 13 children became sick. BreAnne led the outbreak investigation, which involved local, state, and federal public health partners and linked the illnesses to untreated, pressurized municipal irrigation water. She became an integral part of an outbreak that gained media and political attention. She attended a city council meeting where she responded to the concerns from the mayor and council members who were upset by public health recommendations regarding the contaminated water. BreAnne was instrumental in organizing multi-agency collection events and coordinated water shipments to the CDC, providing a valuable connection with the federal partners. Thank you, BreAnne. Next is the award for impact, which goes to Summer Miller, a program manager in the Division of Child and Family Services. Summer is a vital team member for DCFS in all areas of her position. Summer's impact on her team members and the families they work with is inspiring. She's built a trusting relationship with families who often request to work directly with her because she validates, empowers, and advocates for them. She knows how to offer them a voice and works with a trauma-informed work ethic. Summer's talent for knowing each case on her team and all of the intricate details of them is impressive. She can cover any caseworker in a crisis and builds connections with each family her team works with. She has a true passion for the social work and strengthening families. These are only some of the ways Summer has been a positive impact on the children, families, and the child welfare system overall in her career. Thank you, Summer. The award for empathy goes to Coyle Baugh, an executive secretary with the Division of Family Health. Annie provides exceptional support to the staff in the Office of Maternal and Child Health. This past year, while the division had 3 vacant administrative positions, Annie stepped up and provided support across multiple offices and trained new administrative staff when they were hired. She provides service with a smile and makes every effort to make sure all internal and external customers are served with respect and care. Annie has a way of making everyone in their group feel that they are her favorite coworker. Annie has amazing institutional knowledge on ways to process things and get things done, and she's always willing to help. She has a heart of gold and embodies empathy in everything she does. Her laugh lights up the department, and she manages to make everyone feel seen and heard. So congratulations, Annie. Next is the award for innovation. Craven, a senior registered nurse with Correctional Health Services. Caylen is an incredible asset to CHS. Caylen's primarily responsible for completing intake health screenings for patients who arrive into the prison system. This past month, CHS experienced an unexpected shortage of Suboxone, a medication used to treat opioid use disorders. The situation occurred on a Friday and caught everyone off guard. When alerted to the problem, Caylen recognized it would result in significant withdrawal for some patients and compromise the quality of care and patient safety. Caylen immediately created a presentation to help train CHS staff in how to manage withdrawal symptoms and distributed this training to the nursing administration. This small example of innovation is only one of many that show the incredible impact that Caylen has on the team. His contributions to the team improve the quality of healthcare services provided to a very vulnerable population. Thank you, Caylen. The award for equity goes to Hillary Hall, a social worker at the Utah State Developmental Center. Hillary is one of 3 social workers at USDC and consistently lives up to all of their core qualities: communicate effectively, act responsibly, respect others, and encourage growth. With equity in mind, residents are fairly placed in appropriate housing and their rights are monitored and respected. Even when her caseload tripled, Hillary showed up for person-centered planning with correct evaluations and programs. Hillary shows compassion and kindness to the people they care for and is an excellent advocate for them. She communicates well with individuals, guardians, and staff. When Hillary has been assigned to take photographs at different celebrations, she makes custom backdrops to create special memories for our individuals and their guardians and families. Congratulations, Hillary. Next is the award for accountability for Nicholas Crosby, an environmental health and safety officer with the Utah Public Health Laboratory. Nick always makes everyone feel like they are a priority, whether the conversation is centered around safety concerns, lab policy, or personal issues and anecdotes. He's dedicated to ensuring a safe environment for all, physically and emotionally. He holds himself accountable for excellence and he delivers. He's honest, and if he doesn't have an answer, he works diligently to provide an accurate one. All this is done with a consistent attitude of friendly, approachable warmth. His monthly all-hands presentations are exceptionally well-crafted, informative, and engaging. His ability to present information in an accessible and entertaining manner has significantly increased lab team engagement and understanding of key safety protocols. Thank you, Nick. Our award for support goes to a team member in the new employee category. Rachel Devine is a workforce specialist with the Office of Primary Care and Rural Health in the Division of Health Access. PCRH offers loan repayment to eligible healthcare providers who serve the underserved. Rachel identified 7 contracts where funding had been allocated, but the participant had withdrawn. By terminating these contracts, Rachel made it possible to offer an additional $141,000 in loan repayments, improving access to healthcare. During 2023, Rachel provided hands-on support to improve our Vista AmeriCorps members' skills in web design, public speaking, and graphic design. Due to Rachel's support, they completed projects quickly and effectively and also took their new skill sets with them after their year of service and are applying them in new public health roles. Congratulations, Rachel. The award for efficacy goes to Meier, a financial manager with the Division of Finance and Administration in the Office of Finance. He's what you want in a finance guy. Mark stays on top of our spending and watches for ways we can save or be more efficient while also making sure we have enough money to accomplish what we need to. He even worked to track down whose computer needed updating and maintains a list of equipment assigned to his team. He's found charges in the budget that should be assigned to other parts of the department, which helps open funding opportunities for things like conferences or training for staff. Mark even helped develop a rubric to estimate the time, complexity, and costs of reviewing materials in the Office of Public Affairs and Education. This is a data-driven approach that will help us be more efficient in supporting other operational units. Congratulations, Mark. Our first team award goes to the Morgue Operations Team and the Office of the Medical Examiner. In other states, it's rare to complete more than 2 to 3 autopsies a day. The Morgue Operations Team at the OME is able to complete 6 to 8 a day and sometimes more. The leadership team has designed a unique and incredibly efficient, thoughtful, and collaborative system. The staff of 25 assisted in 3,340 exams in the past year. That's more than 9 per day for 365 days. Without the dedication of this team, the office would not be able to complete 90% of autopsy reports in 90 days and would not be able to release the decedents to grieving families in a timely fashion. They've developed more than 100 SOPs, and each employee is well trained on every aspect of the operation. They're genuinely committed to the OME, and there is a tremendous sense of pride being part of the team and contributing to the important work of the OME. Our second team award goes to the Community Transition Waiver Nursing Team from the Division of Services for People with Disabilities. Cindy Ward and Gwen Holman are the Community Transition Waiver nurses and play a vital role in making community transitions from intermediate care facilities safe and healthy. In the past 5 years, the Community Transition Waiver Program, they've helped around 420 people with the medical part of their transition. Cindy and Gwen also provide 1 year of medical oversight to nearly 100 people each. They contact all of these people monthly and see them in person every other month. And they do all this while tracking monthly medical summaries and ensuring ongoing medical needs are met with people's chosen providers. Their support is vital. Reports from families and individuals are always positive about Cindy and Gwen's involvement. Cindy and Gwen have had an amazing can-do attitude, even with their burgeoning caseloads and the extreme number of transitions this year. Congratulations, Gwen and Cindy. That concludes our awards for this quarter. What a list! We're so proud of all that we accomplish every day at DHHS. Nominations for next quarter's awards will open during the week of August 5th. Plan now to nominate someone who embodies the values we live by. Thank you.